Okay, so now we move on into the facial bones of the skull. And again, we're going to study these in lab in their entirety, so don't fret too much about this, but you do need to know a few of the landmarks or features. Okay, so there are actually two maxillary bones. As throw students, you have a right and a left maxillary bone, right? So please consider that very carefully as you get ready to identify bones on a lab practical or quiz. The alveolar processes are where the teeth articulate here. And then maxillary sinus, so this is our last of the paranasal sinuses, and we'll look at these again on another slide. And since we're looking at this from the posterior up, you can't see the infraorbital foramen, right? So inferior to the orbit foramen is part of the maxillary bone. There are palatine, two palatines, so this is actually about 2/3 of your hard palate is maxillary, and then the last third is palatine. So here's our little palatine here. And again, there's a right and a left, and attached to this, of course, is soft tissue and muscle to complete the palate, which is what separates your oral cavity and your nasal cavity. They are continuous, however, posterior, in the posterior of the head. All right, we've cut away, and we're looking from a posterior view here, looking forward, and then a sagittal view here. Right, so here we see the inferior nasal conchae I was talking about. So there's two of these. They create the last of those ridges in the nasal cavity. And the vomer I mentioned previously, which is, again, part of the actual septum. So you see this is a very thin piece right here. This again shows you the inferior nasal conchae really nicely, as you can see it from another view here. Okay, and that vomer bone again is really what's going to attach with that ethmoid bone to create the septum. There are two zygomatics, so those are pretty easy to see. Right? They're just your anterior cheeks, right, the zygomatic bones. And you note again the temporal process, so it's where it articulates with the temporal bone on the side of your face. There are two lacrimal, so these are tiny bones, really, that make up part of the orbit, and there, of course, the lacrimal glands are your tear ducts. So this is where tears tend to drain. They originate on the lateral part in the superior orbit is where you find the gland, but they drain into this area, medial area associated with the nose. So the lacrimal bones are seen on either side. So we see one of them here. And then the nasal bone, of course, is the only bony structure to the nose. The rest of it is hyaline cartilage. All right. The mandible is pretty fascinating. It's, of course, what you consider our lower jaw. We've already talked about the mandibular condyle and the coronoid process. See over here and here, right? There's a number of holes for nerves and blood vessels to pass through, including when we ask you to know the mental foramen. So alveolar processes here, just like they were in the maxillary, right? And again, there's one mandible here, though, but there were two maxillary. And they have, again, alveolar processes where the teeth would articulate. And again, mental foramen for nerves to pass. All right, looking at the orbit itself, it turns out there's about 7 bones that make it up. It's a pretty complicated structure, all things said and done. There's the frontal, the zygomatic from the side, the maxilla, right, the palatine, you just seen a little tip of it right here, the ethmoid and the lacrimal in front of that, and then the sphenoid really forms a lot of the rear. The optic nerve that we'll be looking at much later in the class exits through this optical canal, right? So there's fissures and canals that are very evident, large openings here. So superior orbital fissure here, and there's again the optic canal here. So some large openings in the posterior of that orbit, right? And this again allows a lot of blood vessels and nerves to pass to and from the brain and the eye. All right, here's our septum again and conchae. So just going back over these features. So as we've cut away and we're looking at a sagittal view here, here's some cartilage again between this. The vomer bone, excuse me. And again, a septum is a division. Okay, this gives you a view of sinus, the openings. Here's a frontal sinus, sphenoid sinus. You can actually see these on your sagittal head models too, so do look for that. Okay, So the septum and conchae, you've got bone and cartilage, and it separates the nostrils. The three conchae help air actually experiences some turbulence when you inhale, and this allows it to stay or linger in the nasal cavity a little bit longer, which means it's warmed up because of blood flow to the cavity, and we do transfer some moisture, some water vapor as well in there. And mucus has a chance to trap any sort of particulate stuff in the air that we're inhaling. And all of this is really to prepare the air for your lower respiratory tract. I said generally from the front you only see the inferior and middle conchae. Okay. All right. Cranial fossae. So I mentioned this in lab yesterday. Fossae are depressions, and depressions, of course, to accommodate something here. It's the brain, right? So the middle fossae has the most features, all right, and lots of foramen in here. Okay, and again, so there's what you have here is these large, right, depressions. Okay, the optic canal is there in the middle one, the superior orbital fissure, right, that we saw from the front on the previous slide. There's a foramen rotundum for sensory nerves, a foramen ovale, right, and you see these over here for sensory nerves, and the carotid canal we mentioned previously. And foramen spinosum, right, like the stratum, all right, which is also blood vessels for the meninges, and a foramen lacerium, which lets cartilage, is filled with cartilage and nothing actually passes through it. Okay, now, with that said, I'm not going to ask you these features on your models in lab, okay? So this is just remarking about the amazing amount of passage that has to go between the brain that sits in here and everything else outside the brain, right? There's even, as I mentioned here, jugular foramen in the hypoglossal canal, and glossal is referring to the tongue. So. All right, here's the paranasal sinuses, just to look at them from in context of the whole face. All right, so we said we had the maxillary and the frontal, and then we have ethmoid and sphenoid, kind of color coded to see this. So these are lined with mucus, and they are there to reduce the weight of the bone, and they add resonance to your voice. So the timbre, the quality of your voice is affected by these. They open up to the nasal cavity, so they're not isolated in there inside these bones, right? They drain into that. That's why you can get sinus drainage, right? And of course, if you have inflammation or sinusitis, right, you can feel very congested and stuffed up, and that's just an inflammation of them. Okay. The maxillary are the largest ones, and they are the most difficult to drain. Okay, because they're going to have to go up. So it's their likely site of sinus infections. All right. The hyoid bone is kind of a standalone bone that, I mean, quite literally standalone. It's really kind of cool looking too. It's like to me, it always looks like Halloween vampire teeth, right? And it sits there. It allows some muscles from the tongue and larynx to attach, but it's just anterior to the larynx, or well, superior to the larynx, and just anterior to your vertebral column, right? So, again, the base of the tongue, roof of the larynx, it helps us with the movement of our tongue, our larynx and pharynx. So in the process of speaking and swallowing, it's a really useful bone, right? But it's pretty unremarkable. We'll take a look at that in lab. The vertebral column in whole, you have these 26 bones and 5 regions. So we talk about the cervical, the thoracic, the lumbar, the sacral, and then the coccyx has its own. Okay, so sacrum and coccyx, or coccygeal, are single bones, and they were more than one bone, but they fused and now are only one bone. Whereas the cervical, there's 7, and the thoracic, there's 12 for your ribs or costals, and the lumbar, there's 5. And a mnemonic they have for learning the numbers, though remember I said you don't have to know numbers, is breakfast at 7, lunch at noon, and dinner at 5, right? So these are they're very remarkable, all pretty much considered irregular bones. There's an anterior, posterior curve, right? So these 4 curves. And I say in the cervical region, you curve forward, and the lumbar, you curve forward. The thoracic and sacral curve posterior. And this is important again for posture and proper movement. All right, so we talk about a generic or typical vertebra with something that, so in other words, this vertebra, generic vertebra, would represent all the features we would see on any, pretty much any given vertebra. Okay, so what do they all have in common, in other words? So here again, we're looking down, and here we're looking from the posterior. So a vertebra has to have this opening, right? Because the vertebra allows the spinal cord to pass. So we call it opening of foramen, right? So this is the vertebral foramen, okay? Vertebrae typically have a number of processes because there's a lot of muscles that attach to your vertebra and help you with posture. Many of these muscles are, small groups, but nonetheless, they have to have a site of attachment. And we do, you've got 26 bones for a reason, so you get a range of motion. It's not one solid rod. That would be really awkward, right? So you generally have a body. So this is a support. It's the anterior-most aspect of a vertebra, and it supports the weight. And so, of course, as we go further down the column, right, these bodies should become more prominent. All right? The vertebral arch is really created from features we call the pedicles and laminae, and I'm not going to ask you about those in lab or lecture. Okay, so laminae here and pedicle. So you get this kind of arch that we talk about here. So again, it's really, it's hard to see in a two-dimensional figure what we're talking about here, but it connects this pedicle, this little foot here, to the actual processes here. Foramen, again, created by these pedicles and lamina, right? So we get this whole structure because of that. But the foramen is, again, it allows the spinal cord to pass. And then, as I said, a generic vertebra would have processes. A transverse to the side, a spinous posterior, superior articular process, and inferior. What are these? These are the areas or the places where they are going to make contact with the vertebra above them, superior, and below them, inferior, right? And you can, again, looking down here on this vertebra, you can kind of see that. Now, of course, this is a thoracic vertebra because you see it has a facet or an articulation place for a rib or costal. So bear that in mind. It's not, we do know that this isn't a completely generic. All right, as we're looking at the thoracic region here, and I know this because of the spines and a few other things, you'll notice that, again, these superior facets are kind of almost vertical here, and the inferior ones are down here, are almost, again, they're very vertical here, and the contact they make is really interesting. All right, some regional variation, okay, then the cervical. So how are the cervical, because this is what you'll do on a practical. We'll have some vertebra lying out, and we'll say, okay, well, tell us where they came from. So if you're from a cervical region, you will have smaller bodies, all right, with the exception of the atlas, which has none, right? So here we're looking at the atlas. This is part of the axis coming through here. So the atlas is just a ring, right? So smaller bodies, right? Your transverse processes will have foramen, and this is unique to cervical. So this is a very important thing to look for. And this allows blood vessels to pass, okay? The articulations, right, the superior and inferior, are flattened and horizontal. Here you see one of them here. So not vertical like you saw with the thoracic. The spinous processes are partially split in C2 to C6. Remember, there's 7 of these in total, so here's looking at that. All right, and the special ones we ask you to know are the atlas and axis. Atlas, right, was a titan who supported the earth on his shoulders, so this is C1. And it articulates, of course, with the occipital bone and has no body. The axis has got a specific process on it called the dens, and dens, dental, right, means tooth-like. And this allows, right, the atlas to rotate on the axis. So you'll be wanting to be able to identify that. And here's the atlas by itself here, looking at this projection, okay? We're going to stop at this point and pick up on the next video.